And foremost, I just want to thank you for taking the time to just speak with me on this Friday afternoon. I know that you're extremely busy, so I appreciate that.
Yeah, no problem.
And the work that you're doing is phenomenal, and I hope that we're able to get the message out that you're providing this service to physicians.
Yeah, that would be great because it's going to benefit patients and physicians when we have healthy healers who are not contemplating suicide or having PTSD.
Absolutely. So I'm just gonna ask a couple of questions. Feel free to take as long as you want answering those questions, and we'll wrap up. How does that?
Okay, sounds good.
Okay, perfect. So for those who are not aware, can you explain what service you provide through Ideal Medical Care?
So I actually have a clinic, a standard family medicine clinic, where I see clients in my town through telemedicine, house calls, kind of the old-fashioned doctor with new technology. And the clinic was actually designed by my community. So that's why I call it Ideal Medical Care, because the patients designed their own ideal medical clinic. Now, what created my interest in this is that I was suicidal as a physician working at a big box assembly line clinic. It made me miserable. And so opening my own clinic was sort of my solution to my own suicidal dark night of the soul crisis. And I thought I was the only suicidal physician in the world at the time. I just thought I was sort of an oddball, kind of sensitive, idealistic type. But come to find out 8 years later, after we lost 3 doctors to suicide in my town, that this is actually a national, if not a global epidemic. And so I have been running a physician suicide hotline in addition to practicing medicine right here out of my home business office for 8 years.
Nice. You're going through those suicidal thoughts, and you had those ideations. Did you find any support?
Well, I was so distressed and I couldn't get out of bed for 6 weeks. I wasn't really looking for support. I was trying to figure out how to die in my sleep by just
Mhm.
hoping it would happen. So I was like a lot of people, you spiral down into despair to the point where you can't even ask for help. You're too far gone. And that's
Okay.
where I was.
Okay. So what interventions or what took place to get you out of that dark place?
Well, interesting. I had a dream that actually woke me up from this whole thing. And I had in this dream a vision of just opening my own clinic. I mean, since my misery was provoked by my profession, like most physicians, we have occupationally induced mental health issues. And so part of the issue was just I needed to separate myself from my employer. I was already not working at the time, obviously, but I opened my own clinic because I think by nature, most doctors are business owners and entrepreneurs. So when they're stuck in a little cubicle having to see patients every 7-minute visits, it's just not good for the doctor or the patient. So
Okay.
yeah, I basically, the cure for my suicidal thoughts were to open my own clinic.
Okay. Back to your practice right now. Is there a hotline associated with your practice that physicians can call in to receive some services?
Yeah, I have at idealmedicalcare.org on the contact page. Any physician can reach out to me, and I provide free mental health support, peer support to my peers, and also run group sessions in the evenings some days during the week where I help physicians in groups process through the grief that they have, the trauma that they've seen. They have a lot to talk about, and they don't really feel safe to talk about it with anyone else, because you may not know this as a non-physician, but we actually can be punished by the medical board and by hospital credentialing committees if we admit that we have mental health issues. So it's
No,
something that has
not know
driven
that.
us, yeah, underground. Like, that's why we're not getting help.
Wow.
Yeah.
Hmm.
Yeah, on medical licensing applications, I actually did a study last summer. I pulled down every 50 of the state's initial medical licensing applications and the District of Columbia. And there are at least half the states are asking very invasive mental health questions along the lines of, have you ever sought psychiatric care? Have you ever, in your life had depression, anxiety? And it makes it really hard for these idealistic humanitarian, truth-seeking physicians to answer these questions properly if they feel they're going to be punished. So instead of being honest, they just don't seek any mental health care.
Do you?
Absolutely, it's already happening. Hospital credentialing committees are removing. These are questions that are illegal under the Americans with Disabilities Act. You don't
Right.
get asked these questions at Walmart or the post office, yet
Absolutely.
obviously people can go postal and have issues and all sorts of jobs. And really, I think what these questions should ask is current competence. That's what we want. We want to know, like, are you currently competent to practice medicine safely? It doesn't matter if you had postpartum depression 10 years ago. That's nobody's business. And you should never have to stand in front of a medical board and defend yourself from having, postpartum depression or going to marriage counseling 15 years ago. I mean, this is just invasive and illegal.
I completely agree. Due to COVID, have you noticed an increase in calls through your hotline?
Yep, about double. And now nurses are calling me and people are contacting me from actually other countries. I had a medical student on from Poland on our group session the other night. And so there are people that are hurting all over the world. And I think a lot of medical professionals fear letting anyone know that they're quote unquote weak. We're supposed to suck it up and have that machismo, keep going, put on the starched white coat and keep showing up, even if you're cracking wide open from PTSD, right? So these support calls, people are calling me crying. They're devastated. They're thinking they might give their relatives, their elderly parents, COVID. They might die themselves. They're filling out their, wills, thinking they're going to leave their children orphaned. Like people have gone through a lot of different emotions over the last few months. And sadly, they don't feel like there's a safe space to share their emotions. So luckily, I'm one person that's providing safe space for, a number of health professionals, but obviously I can't handle the sheer volume of emotional needs of all doctors and medical students and EMTs on the planet. So we need more peer support.
And that's a segue to my next question. So outside of your supportive services, are you able to connect these people with any mental health providers or any providers that can assist them with what they're going through?
Yes, absolutely. There's lots of psychiatrists who are volunteering now on sort of a COVID helpline to help each other. I think it's just sort of temporary during COVID, but we need this sort of care ongoing, like every day. Even when it's not COVID, come on, like if you see a toddler with a gunshot wound, you're going to need mental health care. I mean, we see things that are terrible. We see terrible things like just every day. We're having to tell people they have cancer or, that they've got a stillborn baby that we just delivered. Like every day, I think that police officers, firefighters, medical professionals need mental health care, or we're just not going to be emotionally well.
Do you have any numbers that you can share with the general public as far as how prevalent suicides are for physicians?
So physicians are dying by suicide at 2 to 3 times the rate of their patients. So 2 to 3 times the rate of the general public. And if you count, sort of the number of Americans affected by physician suicide, nearly 1 million US citizens lose their doctors to suicide every year.
Wow.
That's a lot.
So Doc, as a counselor myself, I'm sure that I'm dealing with these, hearing these issues and hearing that these doctors are going through these, going through bouts of depressions and things of that nature. What do you do for your own self-care?
I live in Oregon in the woods and I sit in my garden and pet my cat. Had a stray cat just adopt me the other day, purring on my lap while I'm pulling weeds in the yard. So I think getting grounded, I do mosaic artwork, like in between the suicide calls, like I am out, in nature. So nature is very healing to me. I also have like a beautiful partner, who I can talk to. He's a little sick of talking about doctor suicides for 8 years, but he's a sweet, sweet man. And I actually go to therapy every week. So I suggest I suggest for decades now, I've been going to therapy every single week. And I recommend that every single doctor do the same thing. And I don't care if it's your pastor or a peer support group or a psychiatrist or, a social worker. Like, you need somebody apart from your spouse. You will wear out your spouse. There's a reason why your spouse is a librarian and you're an emergency room doctor. They can't handle hearing about all that trauma. They'd rather read children's books, in the library. So you've got to preserve your marriage and your intimate relationships by getting professional help. And I often compare, mental health with dental health. With dental health, everyone is going at some interval to a dentist. They're brushing and flossing, daily. They're on a program. And if you're not on that program, you can expect to have no teeth. That's just what happens, And so if you're not on a program for your mental health, similar to the daily program for your dental health, you can expect in a high-risk profession, like firefighters, police officers, and physicians, you can expect your mental health to deteriorate right out from underneath you, and you will crack wide open and have some serious health issues.
Okay, agreed. Doc, how would someone contact you? Let's give our audience your contact information if they need to reach out to you.
Yeah, so my name is Pamela Wible, Wible like Bible, Wible, and idealmedicalcare.org is my website, and I return emails, sometimes 5 seconds, sometimes an hour if I'm on the phone with somebody else. So I am definitely within 24 hours, you're going to hear from me, and usually it's a few minutes to an hour or two. So, yes.
And I could attest to that. You definitely respond very quickly. So thank you for your time. I really appreciate it. And looking forward to continue this professional relationship.
Thank you so much for having me.